Hi, Brian Boyle here, physical therapist with Workwell Prevention and Care. Today I'm going to discuss a few things in regards to OSHA first aid compliance. So these are a little bit older, in the sense that the 2019-2020, you may have been familiar with these. These were letters that were written into OSHA to get some clarification on common things that are typically considered OSHA first aid prevention. So the first was using ice, but with air compression to allow for reduction of swelling. And the second was if you use a rigid brace that you then remove those rigid stays from, does it still consider this treatment? And so the clarification came in, and the letters were returned and said, hey, we've got some information for you. So the first was the use of ice and compression. So under first aid prevention, you are probably familiar with this, that OSHA does say that ice and heat can be used as prevention. They are used as first aid to help somebody that may have had an injury, to feel better and, to just reduce the impact of the injury. The problem comes in when you actually add in air compression. So because air compression is not listed as a first aid prevention piece, it does now fall under the guise of treatment. It's outside of that. So anything outside of these pieces of first aid prevention does fall into treatment. The second one was the use of these rigid stays. Then the therapist or the provider removes the rigid stays, and now you are left with a non-rigid brace. And was that possible to do that without it falling under the treatment guidelines? And again, OSHA came back and said, hey, guess what? You took a rigid brace, which the prevention literally says non-rigid braces. You took a rigid brace and then you altered it, which would take the fact that you had to have some sort of clinical decision making into effect, which would now make it treatment, right? So now, unfortunately, because you took this rigid stay out, it does now make this a treatment and would fall under OSHA treatment versus OSHA first aid prevention. So these are really important clarifications because OSHA really, the intent is to get the employee the appropriate level of care for the appropriate injury, right? So if somebody comes in and they've got just this general ache or discomfort, prevention is certainly probably the most appropriate. If somebody comes in and they actually have an injury, okay, starting off with prevention may not make sense. And that's where Workwell comes in. So if you've got questions, if you've got additional thoughts, we are here to help you. We're here to be resources as providers that have worked with thousands upon thousands of patients on site. We actually, we're aware of these things, and that's where the guesswork comes out so that you don't have to guess as to whether these things would fall under OSHA prevention or OSHA treatment. So you can go to our website, workwell.com, get lots of more information, and you're going to be really excited because we've got some fantastic updates that are coming to the website. It's an all brand new website that's going to be out here shortly, so be sure to check that out as well. And until next time, we'll see you again.